All right. I will get it streaming here too. And all right. Welcome everybody. It is July 1 and we have a full update for you all today. And we're going to start, as we like to do on Wednesdays, with our special guest, Dr. Leffler, President and Chief Operating Officer for UVM Medical Center, is here, and we're going to talk about the current status of COVID-19 here in Vermont, here in Chittenden County, and the response to it. And we got a lot to talk about. It's an interesting, I think this is actually an important moment in the evolution of the pandemic and how we respond to it. So Olivia, let's, I think we want to start by giving people the latest sense. This is from the dashboard, the city's dashboard, which I, again, encourage people to check out if you want to kind of follow day to day the status of the virus. These are Chittenden County numbers. Again, we've talked about the slide a number of times. You see the left peak, that is the original surge of cases here in Chittenden County when the pandemic began. I always look at this data and it kind of helps me to remember that's probably a dramatic undercount of how many infections we actually had back during that period when we didn't have very much testing capacity. I think it was probably in reality much larger than the spike that we experienced in June. And we've talked about how that's a basically hopeful trajectory as I see it. And as you know, Dr. Leffler and I have talked in the past, what you see there in June is a new outbreak in a couple of communities here in the Burlington, Winooski area. And then you see a lot of testing, a bunch of cases identified quickly, and that a successful boxing in of that outbreak, such that we have had days now without any new related infections. And then you see, you know, there's a little more virus around than there was during the late May, early June period, but back down to pretty manageable numbers of new infections daily over the last week or so. So that's basically a hopeful and a positive story. More indication that here in Vermont, together with the sacrifice of Vermonters and Burlingtonians and government action and the expertise and of our public health officials like Dr. Leffler and his team, we're doing pretty well right now. The next graph, however, is a troubling graph. This is what is going on nationally. That red line is new confirmed cases per million residents in the previous 7 days in the United States, and comparisons with our peer countries or regions, Europe, Canada, and Japan. You see very different trajectories than what is happening in the US right now. It's a national embarrassment. It's enormous concern. I think it's going to make our job a lot harder going forward. And this is, I think it is a function of the fact that the US hasn't really had a national response. It's been a patchwork response. It's hard to see that changing. So our own little patch of the world here, we're going to have to be fighting hard for ourselves. I'm very concerned about this. Dr. Leffler, do you have any thoughts on this narrative?
Yeah, thank you, Mayor. So a couple. First off, I, like you, am optimistic about what we saw in the beginning of June in Winooski. We saw a little surge in cases, and we got it under control. We got the cases contained. It's not, and now, you know, I think we're far enough out from the Winooski outbreak to say that that was handled well, and we didn't see other cases. You know, 14 to 21 days after an outbreak like that is when you'd expect to see whether it was handled well, and it keeps going like we're seeing in some places in the country now. And so that's a good news story, and that I think is very optimistic overall for Vermont going forward. And it's also not surprising to see a little more activity with cases across Vermont as we start to loosen things up a little bit. As we get to a different stage in the pandemic and the Vermont response, having people be out and about more, it's not surprising to see a small number of increased cases. So the news in Vermont, as compared to the United States right now, is still very good. I think I saw there was 2 positive cases yesterday in the state. At the medical center, we only have 2 people in the hospital with COVID right now. We have also 2 rule outs, no one in the ICU right now, no one on a ventilator right now. So that's all really good news. The other thing that's good news is when we had that outbreak in Winooski, we did not see a big uptick in cases that needed hospitalization or became very ill. So that also is encouraging data. Those cases got managed quickly and those people did well. I think in the United States, what you're seeing, as opposed to Vermont, is a lack of coordination between healthcare, government, and the population. And so you have to have a very coordinated response. And so as we see cases really increase in different parts of the United States and different states, depending on what part of the state you listen to or talk to, the healthcare system or the government or people, you see discoordinated responses. And for the US, that upsurge in cases absolutely is going to make it harder for Vermont going forward, because some of those people are going to travel, some of them are going to be asymptomatic. And so this will impact us at somewhere down the road. But I do think that our strategy and the way Vermont to this point has had a very coordinated response bodes well for us in the future as well. We have to keep up that. I think that's critically important. So I'll just stop there. Once again, I see the surge in the US as a lack of commitment and coordination between states and the healthcare system and the people.
So let's, Olivia, let's advance to the next slide here. There are, it's not that, the slide we were just looking at, which does show 3 success stories on there, the US not being one of them, but those other regions and countries really have, it appears right now, the virus, after very big outbreaks in at least Europe and Canada had significant outbreaks. Japan, I think, has been pretty good from the start, as that graph showed. But even these areas that, like, Europe, that had a big problem, have largely gotten it under control. The way other countries have gotten it under control, and I would say Vermont is doing well right now, is because over the last 3.5 months since the pandemic began, or I guess you could start earlier than that, scientists started looking at this virus going back, even into December, I guess. We've learned a lot more about this virus and how it transmits, how it communicates. I remember the early days of this pandemic. Dr. Leffler, you predicted this would happen. You had faith that we would start to figure it out, and here we are. We continue to have these really revelations about the virus that I think speak to how we do a better and better job of containing it. I hadn't quite seen this stat until the New York Times over the past weekend here. This headline: most people with coronavirus won't spread it. Why do a few infect many? And this is a stat on the left side from that article and from studies. There are apparently a number of studies that essentially show something like this. 10% of the people who get the virus do 80% of the spreading. We hear in public policy circles a lot about kind of 80-20 rules. This kind of thing is not unusual, where there's, that if you focus on the right 10% or the right 20%, often you can have a huge impact. That's what this is showing us here. Further, there's still some questions about why this is the case. Perhaps some people get forms of the virus presents in them in such a way that they spread, or risk of spreading it in a different way than other individuals with different cases. But it seems that the context, the settings, have really the greatest impact on whether the person spreads the virus or not. Do you want to, and we have, so we're going to, before we move on, you want to, any reactions to the slide, Dr. Leffler?
Absolutely. And so the tricky part about this virus is a lot of people don't get very sick or have almost no symptoms. And so if you don't have many symptoms, if you catch coronavirus, but you're not particularly sick, but you do all the right stuff, you're still, just because you're doing the right things, you're socially distancing yourself, you're wearing a mask, you're not getting into large groups, you're not going to spread it very much. But if you're not very sick, but you're not really taking precautions to protect others, maybe you're not always wearing a mask, or you go out to a place where there's a lot of people, before you're very sick, you can spread it to a lot of people. So what we know is that if you have coronavirus and you are in a closed space with a lot of other people, you can spread it pretty efficiently to a big group. It's very clear now that, if you're in there for 15 minutes or more and you're shouting, yelling, singing, stuff like that, you can really spread the virus very efficiently to a bunch of people.
Yeah.
And a lot of people do not get very sick. And so it's so important to continue to socially distance. Staying 6 feet apart and wearing a mask is the very best thing you can do to prevent you from spreading it to others. And so those steps are critically important going forward.
You know, I remember hearing for a long time that that we were seeing that the average, we saw this ratio reported many times, right? Like a 2.0 ratio, a 2 to 3 person ratio, that for every one case, it was creating 2 or 3 new cases. And I always had I don't know, I always struggled to envision why it was often reported that way, as if that was sort of the typical spread. But what we know now is, and if you think about that ratio, is if you have 10 people and 9 of them don't infect anybody else, but the 10th person infects 20 other people, that is a ratio of 2. But it is a very uneven spread. And that is actually an opportunity, I think, for containment. It means that if we can find these, keep these large spreading events from happening, we can really keep this under control. So let's go to the next slide, Olivia. This is a new graphic we are releasing today, and hopefully you'll see a lot more of this graphic around town. We've talked about this the last couple of weeks, but we're talking about it again, and this, I think, graphic, I hope really kind of captures the message. And I appreciate our great team at Burlington City Arts and our analytics team that helped put this together. And thank you, Dr. Loeffler, for your team's reactions to this and helping us get this right. Avoid the 3 C's, limit the 3 C's. The 3 C's being, again, and Dr. Loeffler just touched on this, closed spaces, indoor spaces, crowded places, and close contact settings. So situations where you are sitting for an extended period of time within 6 feet of another individual. And, you know, we have those text bubbles in the graphic here, because it turns out talking is in a close contact setting is a high risk activity. The graphic is further trying to communicate that where these settings overlap, there is even greater risk, and where all 3 of them overlap, we really have the potential for what people are calling now these super spreader events, the possibility of a lot of people becoming infected in a short period of time. And so the message here is to limit only going to these settings when you need to, and to take extra care if you do need to be there, and to try to avoid even more so these areas of overlap. Anything else you want to add here, Dr. Loeffler?
So just a couple things. We know that we've had super spreader events in Vermont. Our epidemiologists and contact tracing have proven that they're happening here. And so these are the very best steps we know to help prevent those. And so these are the right things to do. And doing this, once again, helps keep Vermont open, helps keep us being able to have our businesses open, helps keep our schools open, all those things. And so I see this as one of the key things that we can do as a state to not get ourselves in the situation that other states in the US find themselves in right now, where they're really starting to ramp things back down. And that could happen anyway. We could get back into a situation where the virus gets worse here in Vermont, but we know this will help. We know this will help to keep our hospitals from being overwhelmed and help keep less Vermonters sick at any one time.
Let's advance one more slide here, Olivia. And I think we want to hold on to what we just were talking about the areas of greatest concern, and kind of, now apply this to, where we are right now, and the challenge immediately ahead of us. Indoor bars are clearly settings that are in the heart of that Venn diagram there, the area where all 3 C's overlap. If you have a crowded bar indoors, where people are doing what they do in bars, which is talking in close contact with sometimes many other people, that is the recipe for large amounts of transmission. That is exactly what we're trying to avoid, what we're recommending avoiding. And this isn't abstract. We know that part of that first graph we looked at about the country graph earlier, there are increasing reports that a major driver in that trend is people congregating in bars and substantial spreading events happening in bars. We also know this past weekend, there was a lot of activity happening in Burlington bars. And we got many calls in the mayor's office about it. I know the governor was notified about it. There was many Burlingtonians who rightly were concerned about what they saw. And so we got to talk about this. And in part, I really want to be talking directly to people who operate, own, work in Burlington bars. I want to be really clear that there are rules that apply to those operations. The governor's orders, his public safety pandemic orders, require the bars limit the capacity, limit the number of people indoors to 50% of capacity. So whatever the posted capacity, previously judged capacity of your facility to have been, no more than 50% of those people can be there. And there's actually a maximum limit for a really large space of 75 is the maximum, is my understanding. There is not to be any, first of all, everyone has to be seated and no one is supposed to be seated at the actual bar. Tables need to be spaced properly per regulations. Reservations are required to get into the bars. And that is both something to encourage an orderly number of people attending, a limiting of the capacity, but also to give us a record if there is a spreading event in a bar of who was there when, so that contact tracing can be done efficiently. Everyone must be seated again. And another important thing, and this goes for all operations, I believe, and it certainly applies for bars, is every operation that is serving the public must have an on-site health officer that understands these rules. And there's actually a few more rules than we've just listed here, and has the authority to act and keep these, keep the operation in compliance. Libby, let's keep going here. So there were 4 bars in Burlington last weekend who were cited by state officers, liquor control officers, my understanding, for failing to comply with the governor's orders. So there is enforcement action happening. And going forward, I just want to be really clear that we are knowing the risks that these bars represent, knowing what a sensitive time in this pandemic we're at. The city is going to be watching very closely. Bars need to comply on their own proactively, or we're going to have to find a way to take further action. And I think, you know, I am glad that the city acted, you know, back before St. Patrick's Day. I took action to close the bars for that holiday because it was clear there was a big risk. And while I have no desire to do that again, I would strongly prefer us to find a way for these operations to continue. If we have to, if the bars are not following the rules, if we are having further spreading of the virus happening in the bars, I'm going to take action again. We will do what we need to do to protect the health of our community, to keep these kind of establishments from being the vectors for virus spread the way we're seeing in the rest of the country and in other parts of the world. So, Dr. Leffler, any more thoughts on this?
I mean, I think it ties into everything we're talking about. The way to keep things open is to follow the rules. They're set up to keep people safe. They're set up to keep us from having big outbreaks. And so, me personally, I'd much rather have our businesses open at 50% capacity so we can use them and support them than to have them not following the guidelines that we have in place and then having to be shut down. So I would just say I tie this back into everything else we've talked about. It's all about coordination and commitment to trying to keep everyone that we can safe.
Olivia, do we have that one more quote on the next slide or about?
We don't.
Okay, so, you know, just to Dr. Leffler's point, and I want to reiterate that again, we would like to find a way for all activities to remain open. But that same article made the point, you know, if we're going to be able to get our schools open in the fall, if we're going to be able to restore other elements of our normal life in the months ahead before we have treatment or a vaccine, we need the route to doing that for greater freedom and getting our lives back is constraining our activities in certain areas. And that, you know, the 3 C's are those areas. We have to be conscious of them. And by doing that, you know, kind of ironically, that greater caution and greater restriction in those limited areas is what is going to give us greater freedom and greater protection for vulnerable communities in these months of risk ahead of us. So I think that this is what we have to say about the virus today. Is that right, Olivia, or is there another slide?
That's right.
Okay. Dr. Leffler, any final thoughts before we let you go, or anything else you want to share? Okay.
Nope. Thank you for having me again. Great discussion.
Great. Thank you. Thank you very much. We'll see you again soon. And thanks for your leadership up at the hospital.
Right.
Let's
talk soon.
You have a number of other topics we did want to hit on as we say goodbye to Dr. Leffler. You know, we spent a lot of time discussing the FY21 budget in recent weeks. It does feel like we finally got it done last night, and did just want to share a few reflections on that as we start the new fiscal year. Today is the first day of the fiscal year, July 1. And we, about an hour and a half or so before the fiscal year began, the council approved FY21 budget. It's a budget I'm proud of that does a lot of good things. It protects city employees and taxpayers. It puts new resources in for us to continue to make progress and to make new progress on core values, on core priorities: racial justice, the environment, infrastructure, and our pandemic response. We wouldn't have been able to do all this, anywhere near all this, if we had not had as a community an ethic of good governance and financial stewardship over the last 8+ years. Together, we got the city's finances under control. We resolved the Burlington Telecom, a very challenging situation. We built up a large rainy day fund, and that made it possible to make new investments and avoid tax increases, fulfill commitments to our workers, do all that with, we had the reserves to do that. And if we hadn't had them, we would have faced much more challenging choices. The year we face going forward is going to be a continuation of the last 3.5 months. It's sort of a very different time than normal. It will be a time in which some of our abilities will be constrained by the very serious revenue shortfalls we're facing and our need to focus on the virus. At the same time, as I already touched on, we're going to be able to do good new work in many key areas: the environment, racial justice, infrastructure. More details are at that link there, where earlier in the week I released an extensive memo laying it all out. I do just want to say, as much as last night was a good night, was a night where we got, after a lot of work together, the council and the and the administration took important action together. At the same time, I just have to say I'm concerned by some of what came to a head last night. I am concerned that we're experiencing a breakdown in the way that the city functions as an institution. And we saw that in the debate last night. We are not, it's not gonna work if we're not gonna be able to get done what we need to get done as city government if we are doing things like debating $30 budget amendments, if we are grappling with major changes at the last moment that have not been vetted by city staff, engaged with by city staff in any way, that are not clear. I am concerned. The budget passed by a 9-3 vote, a decisive vote. At the same time, to have 3 councilors voting against a budget that had so much good in it is a real concern to me. And it's unprecedented in the last 8 years. There's been 1 no vote against the budget in the last 8 years. And it concerns me for what it sort of suggests about our work together going forward. I certainly fully agree that we are living at a moment that demands change and big change and demands us doing things in new ways. At the same time, we need to preserve local government as an institution. We need to continue some of the long and successful traditions of good governance and collaboration that we have enjoyed here and that has made local government in Burlington so effective for decades. And I intend to do my part in that. I am committed to that form of collaboration, even when I disagree with certain councilors. I think there's a way to disagree while still keeping government functioning. And that is what my goal will be going forward. I'm committed to that. And I think we have the potential to do a lot of good together for the people of Burlington over the next year, if we can find that right formula. So with that, let's move on to some other items. We've got another guest, Amy Bovey, who runs elections here for the city of Burlington, has done so very effectively for years now. How many years now, Amy, have you been running our elections?
I've been in this role for about 5 years now.
Can't believe it's been that long. Amy joined us, came straight to the city government from UVM, and has done just an outstanding job. It's not an easy thing to run elections, as we are reminded of whenever we watch things go wrong in other places around the country. We've had small things before Amy's time. We used to have some, I don't want to jinx it, but Amy has done it as an exceptional record of avoiding election missteps, and we're very thankful for that. It's one of those local institutions that really matters. This year is gonna, just as we just passed a budget, unlike anything we've experienced recently, we're facing a couple elections that we expect are gonna be quite different than normal elections in August, again in November, again in March. My sense is we're gonna have to get used to some new reality here as well. Amy, what can you tell us about the upcoming elections?
Sure. So as we all know, now is not a good time to have large gatherings like we often see in polling places. So to that end, the state is initiating a strong campaign to encourage everybody to vote by mail, which we here at the city are also strongly encouraging. We have ballots available and early voting has begun. Many of you have probably already received a postcard in the mail if you're a registered voter, and if not, it should be coming soon. This postcard has information for you about how you can vote by mail. So with that postcard, there's a detachable absentee ballot request form that you can use. Fill that out, the postage is paid, and send that back to us. We then send a ballot to you at your home. If you don't prefer that option, you can always give our office a call and request your ballot that way, or use the My Voter page system. There's a link here in the slides. It's mvp.vermont.gov. That system will not only allow you to request your ballots, but you can also change your address if you've moved. And you can also track the status of your ballot, which is pretty cool. It can tell you what date we sent it. It can tell you if we've gotten it back. So if you haven't looked at that page, I would definitely encourage voters to take a look. It's got some pretty cool features. So also just wanted to talk a little bit about the instructions for early voting. It is really important that they're all followed. So being that it's an August primary, this is a little bit different in that you're going to receive 3 ballots, one for each of Vermont's major parties. But you're only able to vote one of them. Because we don't do party registration in Vermont, our system is set up so that you get all the choices and you can privately select which one you'd like to cast votes for. So once you've picked your ballot and cast your vote, there's going to be a series of envelopes that you'll receive. One is a certificate envelope. It'll say kind of primary election at the top. This is the one that your voted ballot will need to go into. And the very important thing with this is to make sure that it's signed. Under Vermont law, if it's returned to us unsigned, unfortunately, the vote is invalid. The other piece that's really important is the unvoted ballots. You'll receive another envelope in which you'll place the 2 ballots that you didn't use. Those also must be returned to us, otherwise your vote would be invalidated. The last envelope that you'll receive is a postage paid mailing envelope that you can place your 2 ballot envelopes inside and send back to us. So we'll be looking for those and have already seen very, very strong early voting numbers for an August primary, have well over 3,000 requests and expect to see many more in the coming weeks. But if you are unable to vote by mail or just prefer to vote in person, we will have polling places open and available. We are going to be requiring masks to be worn in the polling place. And we're currently working with the ward clerks, the folks who are in charge of each of Burlington's 8 polling places. And some of those we're working to reconfigure to allow for better traffic flow. All of them will be reconfigured to allow for social distancing. We'll be working on increased cleaning protocols and also making sure that we're not trying to fit too many people in the room at the same time with different capacity limits. So we're working through all of those issues right now with each polling place. And the last thing I'd want to note is that due to COVID, our normal Ward 7 polling place, the Miller Center, was unavailable for use. So for this one election only, we've temporarily relocated the Ward 7 polling place to the C.P. Smith Elementary School at 332 Ethan Allen Parkway. So be sure to spread the word to your neighbors and let people know about the new location if you do live in Ward 7, the new North End.
Yeah, that is a significant change. You know, as long as I've been participating in elections, we've had it at the Miller Center. So this is going to take some real effort to make sure people understand what they need to do. Do you, Amy, think the early voting numbers being up, is that entirely because of that postcard, or do you think there are other factors that are driving this strong ballot request already?
The postcards are a large part of it. The vast majority of requests we've received have been via the postcards, but we definitely have been hearing from folks calling in that they're just not feeling comfortable going out, don't want to be in a large place. So definitely think it's on folks' minds, you know, the situation that we're in and wanting them to stay safe.
Great. Well, I think that's really clarifying for how August election is working. Do we, maybe it's too early and it'd be confusing to start talking about the November ballot, but we are taking, is it right to think we're sort of assuming that COVID is still going to be something we're dealing with in November and possibly March as well, right?
Yes, absolutely. There's still a lot of details to be finalized, but the discussion at the state level at this time is that most likely absentee ballots will be automatically mailed to all registered voters for the November election, unless a person chooses to opt out of that system. So like I said, that is still being worked through, but that is the proposal at the moment.
All right, so the bottom line, the voting is open. If you want to vote by mail, send back that postcard or otherwise request a ballot. There will be an election day too, though, and you'll have the normal, maybe in a different location if you're in Ward 7, but the typical options with some new rules in place on August 11th, primary day.
That's right, yep.
Excellent. All right, well, thank you, Amy. Thanks for joining us. And thank you, moreover, for what a great job you do keeping these elections running well. So,
thank you.
Let's, I see Cindy White is here. No special outfits today, Cindy.
Hey, we got our summer picnic dress on today.
Okay, all right. I spoke too soon.
I didn't bring my picnic basket, but I brought my summer picnic dress.
Well, isn't that appropriate for talking about grazing on the Greenway? This is the latest of the new programs we have been rolling out over the course of the summer of 2020 to try to restore some level of activity and options for Burlingtonians and to create some options for economic recovery that are safe, that avoid the 3 C's, that give people some options for dining or in some cases retail activities outside, away from crowds. And I'm excited about this one, Cindy. This is a great idea. I think people are going to love this, and it's starting really soon. I'll let you fill in the details.
Great. All right. So big kudos to Emma Allen, who's our events coordinator. So Emma has been coordinating Letty Beach Bites now for several years, which was incredibly popular, especially with our new North Enders that were able to have their meal out and about on a Wednesday night. But the staff looked at and realized that we had to cancel Letty Beach Bites, your 3 C's, everybody close together in one small space. So then there was a thought of how could we recreate Letty Beach Bites? And Summervale's not happening this year. Arts Riots food trucks not happening. So there was that sense of recreating Letty Beach Bites, but also thinking about these businesses who no longer had these options to have their food trucks out. So you combine those two and we came up with grazing on the Greenway. So the idea here is there'll be 3 spots on the Greenway. So we're spreading people out. If you live down near Letty, you might stop down there or have something along the way at Waterfront Park and then also out at Oakledge. So we'll have food trucks at all 3 sites from 11 to 7, Thursday through Friday. And then we'll have a 4th truck on Durham for a lunchtime at Waterworks Park from 11 to 2. And so folks that can't remember, they've heard of Waterworks Park, but not sure where it is, that's the one out by the fishing pier. So tuck on there, you could have a little bit of a lunch Thursday through Sunday. And then the other one that we are working on getting coordinated, looking to start next week, is some neighborhood ones. So thinking about, maybe Ethan Allen Park or out at Callahan, having some trucks in some of our neighborhood parks. And we're looking for those to be on Wednesdays. So sort of that our typical Letty Beach Bites date. But looking to have those start next week. If anybody's interested that has a food truck, we're looking for more. Interestingly enough, we really won't quite have enough to pull off all the different neighborhood parks that we were interested in. So if anybody does have a truck and they didn't hear from us, please reach out. And the trucks will rotate every 2 weeks. So if you are kind of tired, you've 2 times at one park and you think, gosh, I want something different, but I don't really feel like biking down to Oakledge. Just wait 2 weeks and there'll be a different truck there the next time.
That's great. So are all of these, is the plan for one truck in each location, or are there multiple trucks?
I believe it. Emma's my backup, and I have to admit that I am not exactly sure if there's more than one at each spot. That's a really good question. Emma, can you save me on that one?
There will be one truck at each location, with the exception of the center of Waterfront Park. We will usually have two. We'll have a fun ice cream vendor, and then we'll have a dinner truck. So a little bit of variety everywhere.
Can,
just
go ahead, Cindy.
I was just going to remember a few details. I've got my mask here. It's going to be important. You might have to be waiting in line. So the 6-foot social distancing, make sure that you have your mask on. And then, as people are already doing in our parks, people find their own space to sit in, not right on top of others. But that's something that we found is nothing that we've really had to worry about in the parks. People naturally find their own space, and they're not crowded together when they go to sit down and have a meal. So, and then just a little shout out to Beansies up on Battery. You get that all the time. They're up there, and they've done really a really nice job. Beansies has of having the setting out stations for people to stand and waiting for their order. So, so that's almost like a food truck that's all the time during the summer.
Excellent. So great. So can people at the website there, do we have, can people kind of check out what truck is going to be where, when? Do we have that kind of functionality?
We'll have that information. We're fine tuning it. It's a new program for us that we're kind of quickly trying to get turned around. So we'll be updating it as we go. But the idea is that people can look to see, what's the food truck that week? Do I want to swing by? And so we really encourage people to get out. It could be kind of a fun lunchtime activity. You could go, take your bike or your feet and go for a walk or a bike along the Greenway and pick up some food and support our local businesses. These are all our local businesses that are out in these food trucks.
Well, Cindy, thank you. Thank you, Emma. I think this is a great additional program. People love food trucks. It is a way for people to be outside. And I'm excited. We're using the brand new Waterfront Waterworks Park for this. If you haven't been down there yet this spring, it's basically the second full season of operation. It's really starting. The plantings are coming in there. It looks great. People should check it out.
It's kind of like that sort of hidden spot where we're watching the sunset. It's spectacular there. And it's just a small crowd because a lot of people don't completely know it's back there. But you can sit at the fishing pier, or there's just one beautiful rock seat that was a gift from one of our community members that's at Waterworks Park too.
All right, excellent. Why don't you stick around, Cindy? Our last item we want to talk about today is July 3rd and 4th, and what those special days of the year are going to look like this year. We certainly are, as has been widely reported, the typical annual festival down on the waterfront is not going to happen. It's just no way to do that and stay safe, as we've been talking about with the crowds, even out. We know that outdoor activities are much safer than indoor activities, but still, the way that our firework gatherings usually are, people are just packed in at the waterfront, and it's not something we can do safely. So go ahead, Cindy. Why don't you describe the new plan?
Sure. So we called our reimagined July 3rd, because we originally reimagined it for crowds, and then having what's going on in the country and our current racial crisis, we also realized that we needed to have a little bit of a lens with that, because as we all know that in 1776, Independence Day wasn't freedom for everybody. So we're, taking that in light of our celebration this year. And it's a little bit of a quieter time this year, a reflective time, but we also don't want to lose the fact that it's a wonderful time to get together as a community. So we say together and yet apart. So encouraging people to celebrate in their backyards or on their front stoops or on their sidewalks, as not everybody has a backyard. But have that chance to celebrate with your friends and your family. But we want to hear about it. We want to hear what you're doing. We want to see it. So we have a social media hashtag BTV July 3rd, which is our normal hashtag that we use for July 3rd. And we're really encouraging people to take a picture, take a video, and share what you are doing on July 3rd in this unusual year. And then also in that sort of sense of when we were all kind of stuck at home and people were doing, you know, making noise at certain times because you were stuck inside, you could go out and see your neighbors. We're doing something similar for July 3rd. So at 7:30, encouraging people to, you know, make noise, whether that's an instrument or ringing a bell or singing, to connect again as a community. And then following that, we'll have the fireworks will be live, and I say quote live because they're the 2019 fireworks that ABC 2244 is going to be putting up for us, and that will be live. So those of us like myself that don't have normal channel TV, you can still see it. So you can go to their website and you'll be able to watch the fireworks, enjoy them from last year's fireworks at 7:30, and then again at 10:30.
Great. Thank you, Cindy. I think we covered everything there on the slide. So why don't you stick around and see if there are any questions about what the plan is. And Olivia, I think let's open it up for questions if there are any.
Great. So reminder for members of the media, the way to submit a question is by emailing me. And then if you're here in the Zoom, I will enable your microphone and you can ask your question directly. And if you're not, you can also email me the actual text of your question too, and then I will read it out. So our first question today is from Aiden Quigley from VT Digger. And Aiden, you should be able to ask now.
Hi, I'm just wondering if you could kind of expand on the 4 bars that were in violation this weekend. What bars were they, and was there anything, you know, what was happening there?
What was happening, Aiden, is there were at least these 4 bars that were operating in a manner not consistent with the governor's order, and the 4 bars that were given written warnings for illegal activity in violation of the governor's orders by the DLC were Red Square, Aches, the OP, and JPs. So those, I think that answers your question.
Thanks.
And I think that's all the questions that we have for today for members of the media.
All right, very good. Thank you all for tuning in, and we will see. We'll be in touch on Friday whether there will be a briefing on Friday as well with the holiday. Unless there's significant developments, we may not have another briefing this week. We certainly will continue to be in touch, and look forward to seeing everyone on the other side of the holiday if we don't speak again soon. So thanks, everybody. Take care. See you soon.